Surgery, a surgery known as a tummy tuck. It removes excess skin, fat, stretch marks, and tightens the separated muscles. Most importantly, this week surgeons learned about a revolutionary new technique that promises improved patient comfort and recovery time. So joining us this morning is Dr. Harlan Pollock from the Texas Institute for Surgery, which is in Dallas, and he is the pioneer of a very new tummy tuck procedure. Thanks for joining us this morning.
Thank you, Emery.
So let's start with a tummy tuck is not liposuction. A tummy tuck is to do what specifically?
Tummy tuck is a procedure which is geared for pregnant women or women who have had pregnancy, who have excess skin, stretch marks, separation muscle,
right.
And it relieves that by excising the excess skin.
So really, when you talk about separation of the muscle, it doesn't matter how many crunches you do, there's no tightening that up.
Unfortunately, that's the truth.
Okay.
There's really only so much you can do with diet and exercise. Surgery sometimes is necessary to take care of the real problems that so many women have after pregnancy.
Yeah. So let's talk about this technique that you've pioneered. How is it different from the tummy tuck that we're more familiar with?
Well, a standard tummy tuck is usually done by mobilizing the skin and then removing all the excess skin below the belly button by pulling the skin tight, but it's done pretty much as pulling a bed sheet tight, which means it leaves space underneath and drains are required to remove any fluid that might be there. Fluid accumulation after surgery is the biggest problem we have with this surgery.
Right, and when there's fluid accumulation, what are the risks?
Well, the risk is it could be chronic. You could keep that. It requires removal of the fluid by needle aspiration, and it's a nuisance. It usually isn't a major problem, but it could even become infected.
So this new technique is different in what way?
It's different because instead of pulling the skin tight as a bed sheet, we advance the skin and place sutures to hold it in place incrementally or sequentially down the abdomen. So we use multiple sutures to hold it in place, much as you would do a quilt. And so these are quilting type sutures.
Does that mean less scarring because you don't have these tubes?
Well, not because of not having the tubes, but yes, it means less scarring because there's less tension on the skin that is pulled down on the incision. Also, it eliminates the need for drains, which is a really good thing.
Right.
Plus, it allows patients to stand up straight after surgery instead of having to be bent over, which is very common after this surgery.
And recovery time shortened?
Recovery time is easier. I don't know if it's shortened, but it's certainly easier.
So it's a newer technique, but it's not sort of brand new. You guys have tested this, you've done studies. What are the results?
I've actually been using this for almost 40 years, so
okay.
It's been a long time.
Yeah.
But we did do a recent study of 600 consecutive patients. I did this with my son, an associate, and we showed that we had a very low incidence of complications, less than 2%. We had only one accumulation of fluid out of 600 patients. The usual incidence, depending on the particular study, is anywhere from 5 to 50%. So it really reduces the amount of complications after the surgery.
So who's the best candidate for this sort of surgery? It's not a treatment for obesity.
It's certainly not a treatment for obesity, but it is used for patients who have weight loss surgery or lose a lot of weight. Our usual patient, though, is a woman who's had one or multiple pregnancies, has excess skin, and all the other things related to pregnancy.
Age doesn't really matter?
Age doesn't make any difference.
All right, Dr. Harlan Pollock from the Texas Institute for Surgery in Dallas, Texas. Thanks for joining us here.
Thank you very much.